Lindsey Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. 2025 has been a consequential year in the U.S. CDC, and today's guest, Dr. Deb Houry, was in the midst of all of it until late August, when she resigned from her position as Chief Medical Officer and Deputy Director for Program and Science. In her 11 years at the agency, Dr. Houry served in various leadership roles and collaborated with private and public sector constituents to address key issues such as data, modernization, and health disparities. Overall, Dr. Houry has more than 20 years of experience in emergency medicine and public health with a focus on addressing infectious diseases, chronic health conditions, and injuries. She's received multiple honors and awards for her contributions to the field of public health and has been an attending physician and volunteer faculty member at Emory University for many years. Thank you so much for joining us today.
Thanks for having me. Looking forward to the conversation.
So we always like to kick things off by learning a bit more about our guests' journeys. Can you tell us what first sparked your interest in medicine and what drew you specifically to emergency medicine?
Yeah, I think it was honestly a calling. Like no one in my family was in medicine, and in high school I loved science and was pretty gregarious, and so I ended up volunteering in a hospital as a candy striper, and just was really drawn to it. And then in college, worked as a house staff assistant, shadowing doctors, including overnight shifts, and found myself drawn to the ER. Even though I was supposed to be up on the wards, I just loved the ER. And for me, it was just because it was a safety net. Anybody would go to the ER regardless of age, race, income, educational status, and people were really needed in their time of need, regardless of insurance as well. And so for me, I loved the variety, the patience, and it just felt like home.
That's a great story. Did you always see yourself having a role in government, or was that kind of an unexpected path?
Not at all. And it's funny because my father and my sister are both in government. I grew up, near DC, and I said I was never going into government. I was doing things differently, so I went the medical route and loved what I was doing in academia. I was teaching in the School of Public Health. I was doing my own research. I was seeing patients. Over time, though, CDC was in Atlanta. They would reach out to me with different positions, and I'd say, nope, I'm good, like doing what I'm doing. And at one point, when I'd become tenured and was further along in my career, I realized that if I was going to do something like government, that was the time for me because I felt like I'd established myself as an educator and a researcher and a clinician. And at that point, higher level type administrative work where I could have a greater population impact made sense. But that was definitely not on my career path. I was thinking provost or chair or something else, but did end up like my family, I guess.
That's really interesting. It sounds like your career took some surprising turns. So, provider, educator, researcher, and then you kind of enter your path into the government. Can you tell us a little bit about making that transition to the CDC and help us understand the scope of the agency's mission and really how it works?
Yeah, so when I first joined CDC, it was to run the injury center. And so that included work in overdose, firearm violence prevention, suicide, drowning. And to me, as an ER doc, I saw all of those as the leading causes of death, particularly in those, age 50 and under. So it was personal because I just thought there was a lot we could prevent. At that time, the budget was smaller for the injury center, about $140 million. But coming from academia, and that did seem quite large, but we had programs in all 50 states and worked a lot with health departments and local communities at the CDC in that center. That was about one of 10 to 12 centers and offices and institutes across the agency at CDC. CDC has several centers focused on infectious disease, occupational health, chronic disease, birth defects, and injury was one of them. While I was at Injury Center, I was able to nearly quintuple the budget, growing things in suicide and overdose. Those programs weren't funded when I started. And by really talking about the burden and the need for public health and prevention, we were able to get congressional appropriations. And then I was asked to be the acting principal deputy director after about 7 years at the Injury Center. And in that role, I was really looking at what were the lessons learned from COVID and how could I help the agency on things like data modernization and lab, and then transitioned after that to the chief medical officer position.
You mentioned something that I want to come back to, COVID-19. Of course, one of the most defining chapters in recent history was the COVID-19 pandemic. And given your experience, I'd love to hear your perspective on what you see as the agency's most significant achievements during that time, and where you think there are opportunities to be more effective in the future.
Yeah, so certainly there were a lot of lessons learned during COVID. And I was in the injury center for the early part of the pandemic and would come in and rotate as we all would onto the COVID response because it was truly an all of agency response at one point. But I wasn't the one leading a lot of the efforts, particularly in the beginning. What I would say is the vaccines that were part of the Operation Warp Speed and getting them out so quickly to communities was really important because that allowed people to really be able to fight the disease, and to realize that there was protection if they were infected. It would protect them against serious illness and death because so early in the pandemic, we saw people who didn't necessarily have underlying risk factors, become sick. Clinicians, we were seeing that happening. So I think really getting the vaccines out quickly. Where I think, CDC had a lot of lessons learned was around things like data. It took a while to get data from states and to have it in a timely fashion. Part of that was because CDC can't just say, we want your data. There has to be an agreement with states. And so that took a while to have some of those data use agreements. So going forward, data is much more timely and actionable from states, and there's a better agreement system in place for that. And then there were lab quality issues to where there were some testing errors. So after that, there's now a review process at CDC. Secondary lab always reviews things. And there's a lot more work with the private sector now for scaling up. So I think what I appreciated about CDC is they saved millions of lives in partnership with healthcare providers and other agencies around vaccines and risk mitigation. But with the things that they learned, particularly around like lab and data, they took that, ran with it, and worked on improving the agency to be prepared for the next pandemic or outbreak.
That's a really thoughtful reflection. It sounds like there's a lot to be proud of, like the vaccines you mentioned, and also some really important takeaways for next time, like the data and the lab quality. So, in recent months, several states have developed their own vaccine guidance for their residents, separate from the CDC. I want to know what you make of this move, and do you expect to see more of this at the state level?
I certainly have mixed feelings about it, but very much understand the need for it. I think when you look at some of the changes to CDC, including the vaccine committee, the people on it don't have the depth and breadth of expertise as prior vaccine committees. And there's been concerns too that some of the members have conflicts of interest given that they've been part of lawsuits against pharmaceutical companies. So when some of the guidance has come out that hasn't necessarily been aligned with science and data, I can see why other states or universities and other clinical organizations are developing their own guidelines. I think what concerns me about that is, what happens when there's disagreement between organizations? There hasn't been yet, but let's say PEDS and OB-GYN, disagree on an approach to vaccines for moms and babies. Or what if one state, has different vaccine access than the neighboring state? We're going to see more of medical tourism. So I think what is important with a lot of these is to just be very open and transparent with the guidance. Some states have said, adopt CDC guidance, or if the CDC guidance restricts access or changes things, then they default to some of these evidence-based other groups. And so I think that makes sense. With a lot of these regional collaborations that are standing up as well, in my mind, it's not to replace CDC, but this is a time to reimagine public health, to reimagine that public health healthcare system integration, and to look at what happens where we can do things differently around data, health policy, vaccine access. And so I know pendulums swing, and so pendulum could swing again. And that's why I hope that the efforts that people are doing now are sustained and they're thought about how do you do it to supplement and augment the federal government instead of just replacing it.
Absolutely. It's been really interesting to see, and I think it's something a lot of people are following. And I think it raises that important question about balancing national guidance with that local flexibility, but overall maintaining consistency and public confidence. As a follow up question, do you think this is just a temporary shift, or are we seeing a new kind of public health landscape take shape?
I think we're probably seeing a new public health landscape take place. And I think during COVID, there were lessons learned, and that certainly changed trust in public health and, in medicine. And so people usually respond most within local communities or states. Like that's where a lot of decisions are made and or with their healthcare providers versus at the federal government level. So I think local public health is really important during this time. I do think consistency, and standardization can be helpful so that we don't see huge variations across states because we know that diseases don't have borders. And so, it's important that people still have access to preventative services, vaccines, and other things in an equitable way.
Absolutely. I want to shift gears a little bit and talk about you. Can you tell us what's next for you and what opportunities or challenges are you hoping to take on next?
So this is just a great time to kind of think through where I can continue to innovate and have population level impact. I started an LLC. And I'm, working with one client now on reimagining public health when we're looking at things like data and preparedness, similar to what we just had the conversation on. And then I joined a speakers bureau, and I've been talking a lot about leadership during change. Certainly, I'd say the past year and really the past 10 years, I've learned a lot about leading in crisis situations. And so for me, those are some of the exciting things that I'm diving into right now. I'd say still looking at advisory roles and keeping my mind open. For me, I've always been a mission driven person, the ER and in public health. And so it's finding where I can continue to serve populations, but to innovate and do things a little differently. I think now I've got some time to think through, what brings me joy and continue to explore.
That's really exciting. And we can't wait to see what amazing things you'll be doing next. We'll be certainly watching. So, speaking of the future, we're always looking ahead too. And at Osmosis, we love creating content that fills knowledge gaps. Is there a topic you think we should cover that's especially important or interesting to you?
Yeah, I was thinking about this and a couple of things came to mind. And one is really, we talk a lot about chronic disease and how we can prevent chronic disease. Certainly, there's a lot on chronic disease management, but I think looking at where you can partner things like technology, but also like biomarkers, like how you can have all of those things combined to really prevent and manage diseases. Now that there's so many new AI agents and technological advances, how do we use that in our disease prevention and management aspects? And so that's something I would be interested in certainly learning more about. That was one area. And then, drug overdoses, we've seen that really evolve and change over the past few years. And fortunately, it's on a decline right now, but we're also seeing new drugs, in the market. So I think just being really cognizant of some of the substance use trends and what we need to know to both recognize, respond, and treat it.
Thanks for sharing those topics. We're always eager to spotlight meaningful topics, so we will certainly consider those moving forward. So, since many of our learners are just starting out, we'd love to hear what advice you would give students and early career health professionals interested in public health.
Yeah, I've had so many questions and even concerns right now because public health is really at a pivotal moment. And what I would say is don't be discouraged. We need the champions, we need the people that are advocates for patients and communities. And although right now, federal government and likely in state health departments, there won't be as many jobs for public health. That doesn't mean that there won't be in the future and that there's not other aspects that public health are really important in. I think when you look at corporations, there's a need for public health as you're looking at the populations of workers and the communities that corporations are in or the products that they have. I think if you look at consulting companies, gosh, public health, they're known for conveners, they're known for epi and stat skills and for health policy. So many different opportunities for things like that. And then certainly when you look at nonprofits or healthcare systems, there's that bridge with public health. So I think this is just a time to kind of reimagine what is public health, but we need people who are passionate about it to go into it at this point. I think it's just being flexible and open-minded as to what that first kind of job or role looks like.
That's really great advice. And just to kind of play that back, don't be discouraged. We need you now more than ever. There are many healthcare careers, even non conventional opportunities to consider, and we must reimagine public health.
100%. Yeah.
Before we go ahead and wrap up today's episode, I wanted to give you a chance to cover anything that we didn't that maybe we should have. Is there anything we should kind of come back to?
The only thing I would just say is there's been a lot of attention about my recent resignation. And what I would just say about it is I believe in data and science and protecting populations, which include, our patients. And I think In medicine and public health, we must always follow what our North Star is in scientific integrity. And I just encourage all of you to always do that. Do what is right for your patients and your populations. I always joke that that's what helped me sleep at night in the ER. And that's, what I did recently to really just kind of raise a signal about what was going on in public health in our country.
That is such a great way to close today's episode. I think we've covered a lot of ground, and I just want to thank you again, Dr. Houry, for being with us today. We will certainly keep an eye on what you're doing in the future, and thank you for all of your work.
Thank you.
And that's a wrap on today's episode. We appreciate Dr. Houry sharing her insights and vast experience with us today. Her leadership at the CDC and her ongoing commitment to public health have had a profound impact, and it's been a true privilege to learn from her perspective. I'm Lindsey Smith. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.